Hello, you're welcome to my platform. I am Dr. Sandra and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about thyroglossal cysts and fistulas. Thyroglossal cysts and fistulas are abnormalities of the growth and development of the thyroid gland. The thyroid gland is the organ that is located on the front part of our necks, and it is responsible for the production of certain hormones, for example, calcitonin, thyroxine, and triiodothyronine. So what happens is that around the 4th week of gestation, when the unborn child is still in the uterus, the pharyngeal arches start to form in that area where the head and the neck will be when the child is finally born. The pharyngeal arches grow in that area from the top to the bottom, and at some point they join and fuse in the midline. The pharyngeal arches are responsible for the formation of the structures of the head, the neck, and the throat, including the thyroid gland. The pharyngeal arches initially grow in 6 pairs, and they are numbered from pharyngeal arch number 1 to pharyngeal arch number 6. After some time, pharyngeal arch number 5 disappears, and we are left with only 5 pairs of pharyngeal arches. The pharyngeal arches are usually divided from one another from the outside by a structure called a pharyngeal cleft, and from the inside by a structure called a pharyngeal pouch. Normally we have 4 pairs of pharyngeal pouches and 4 pairs of pharyngeal clefts. The pharyngeal clefts are numbered from pharyngeal cleft number 1 to pharyngeal cleft number 4, while the pharyngeal pouches are numbered from pharyngeal pouch number 1 to pharyngeal pouch number 4. At around the 20th to the 25th day of gestation, when the unborn child is still in the uterus, the thyroid starts to form and develop between the pharyngeal pouches 1 and 2. This is usually in the midline, and it is between the anterior, that is the front 2/3 of the tongue, and the posterior 1/3, that is the behind 1/3 of the tongue, and this area is called the foramen cecum. The thyroid gland starts to form in this area as an outpouching, a structure called a thyroid diverticulum. This structure called the thyroid diverticulum penetrates deep into the core of the pharyngeal arches, that is the mesoderm, and it starts to grow. At around the 5th week of gestation, when the unborn child is still in the uterus, this thyroid diverticulum starts to migrate downwards, and it usually migrates in the midline, crossing the front part of the hyoid bone, which is a bone within the neck, and it goes and rests on the front part of the trachea, the windpipe. During this time, when the thyroid diverticulum is migrating downwards in the midline, it is usually attached to the tongue by a structure called a thyroglossal duct. By the 7th week of gestation, when the unborn child is still in the uterus, the thyroid reaches its final destination, and this is usually the front part of the trachea, that is the windpipe, specifically in front of the 1st and 2nd tracheal rings. Normally, around the 10th week of gestation, when the unborn child is still in the uterus, the thyroglossal duct is supposed to obliterate. It is supposed to disappear. If this does not happen, we end up with a condition called a thyroglossal cyst. The thyroglossal cyst can get infected and it can burst. We end up with a condition called a thyroglossal fistula. In a setting where we have a thyroglossal cyst, it presents as a painless swelling, usually in the midline of the neck. This swelling is usually mobile, and it moves up and down on swallowing, and it moves upwards on protruding the tongue. In the setting of the thyroglossal fistula, we end up with a small opening, usually on the midline of the neck, discharging pus or mucus. These two conditions are common in children and adolescents, but they can also present later on in life. There is something I want to emphasize about the thyroglossal cysts and fistulas. These two conditions are associated with recurrent infections, especially when the person gets an upper respiratory tract infection or if they get a pneumonia, the cyst can get infected and this can be recurrent. These two conditions are also associated with a cancer called papillary carcinoma. The investigations that we carry out in the thyroglossal cysts and fistulas include thyroid function tests. We also do ultrasound scan, CT scan, MRI, as well as a fistulogram in case we have a thyroglossal fistula. When it comes to the treatment, we employ antibiotics, especially if there are signs of infection in the cyst. We can also do a surgery called a cyst trunk procedure, and this entails removing the entire cyst together with the tract up to the level of the foramen cecum, that is at the base of the tongue. The take-home message is, if you or your child has the symptoms that I've just laid out, for example, a small opening on the front part of the neck discharging pus or mucus, or a swelling on the front part of the neck, there's a possibility that they could be having a thyroglossal cyst or a thyroglossal fistula. So please bring them to the hospital for proper assessment and subsequent surgical intervention, because these two conditions cannot resolve without surgical intervention. These patients tend to have recurrent infections. For example, when they get the respiratory tract infections, for example pneumonias, even the cysts and the fistulas tend to get infected. These two conditions also tend to have a possibility of transformation to cancer, a cancer called papillary carcinoma. So please come to the hospital earlier on after seeing these signs and symptoms, such that a surgery can be done. Yes, that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.